In today's video, I wanted to give you all an update on how we're doing, especially how Dad is doing with the different types of therapies he's involved in, as well as talk specifically about the field of music therapy. Whenever a friend asks me about my father, I tell them that medically he is doing well, but cognitively and linguistically he is struggling and he's still far from where we would like him to be. So we go to physical therapy and occupational therapy twice a week, and then we see vision and speech therapy once a week, in addition to his other medical appointments. But right now, it is mostly therapeutic appointments since a lot of the acute medical needs have been kind of taken care of and stabilized. In physical therapy, he's making a lot of progress because I think the gross motor movement required for walking comes back usually before the fine motor movements, such as using your fingers, do. Because of his progress, he seems to be more motivated to practice and get out of his wheelchair and move around. In regards to occupational therapy, what is odd is that the movements in his fingers, such as grasping and pinching, are developing at a faster rate than his ability to lift his elbow and use his shoulders. After his stroke, he developed subluxation in the shoulder of his affected side. We think that his slower recovery in his shoulder also has to do with his work as a chef for decades. But also because of his shoulder issues, the progress with his hand is slower than it would normally be, since limitations on his shoulder's range of motion affects the ability to move his wrist and hand. As we recognize that the body is a system, Dad also needs vision therapy to learn and automate skills like scanning and to strengthen his eyes since he has a visual field cut on his right side and he has been seeing double. With regards to vision, there may be no problems with the input, but somewhere in his mind, things get scrambled. Drawings of various objects look the same to him, and he does not verbalize written symbolic language correctly. So far, he seems to be better able to discriminate by color. Sometimes, when he is at the vision appointment, he demonstrates his annoyance because he either knows what is happening and thinks we're treating him like he's ignorant, or he knows that he has lost some of his abilities and is embarrassed or frustrated about it. Another observation is that it seems if something is out of sight, it is also out of mind. I could be with Dad for a while and tell him what I'm doing and then go and do it and come back, and sometimes he would be surprised that I was there. I can't imagine what it's like in your mind to have such a limited visual memory. You not only need to perceive the world around you, but your ability to recall a picture in your mind is necessary as a basis for planning your next actions. Apraxia is the disorder that affects your brain's ability to plan and execute voluntary movements. In regards to speech, this means that Dad has trouble planning and executing movements required to produce certain sounds in language. Dad's unprompted utterances are more accurate than his prompted ones, which is also known as voluntary speech. He is more likely to speak coherently when he initiates verbal communication, which is his automatic speech. So at this point, we're trying to work on making certain phrases more automatic. He's been trying to use his language to give an approximation for things he knows he struggles with saying or remembering how to say. I might ask him something like, "Who's more bossy, me or Mom?" He'd tell me in the language that is easiest to retrieve at that time, of course it is the second one. This doesn't always occur, but it has happened a few times. Though I don't know how far he will go, we're grateful to have him as he is at this moment. And some of the many blessings we have is that Dad often tries to joke around, and he has forgotten some of his negative memories and lives more day to day instead of being stuck in the past or embittered by its burdens. Now, I wanted to talk briefly about music therapy. I'm not a music therapist, but I am musical, and I've tried to apply some of my own theories to help Dad as his body worked to reestablish connections with his brain. Though Dad was mostly out of it in the first month or two post-stroke, I thought it would be comforting and healing to hear familiar music. I would sing and or play music near him, songs that were familiar and even some songs that were just soothing. To stimulate the brain and body connection, I also try to massage both his feet and tap him rhythmically on both legs. By massaging or tapping him at the same time in rhythm, he could possibly anticipate when the tap will be on his affected side. Our neuro ICU nurse had requested a music therapist to come. She told me about the option, and I told her of my interests since Dad really liked certain types of music and he used to sing karaoke. The music therapist came with a keyboard, guitar, and other instruments, as well as prepared music to perform on guitar and sing. We both sang together, though Dad seemed to be sleeping mostly. According to the American Heart Association, a stroke survivor's ability to speak can be affected, but not their ability to sing. When Dad was able to speak more, I turned on some karaoke from YouTube and we sang more familiar songs. Even though he might have trouble speaking, he was able to sing songs with lyrics that he had remembered. I think one benefit of this is that it had the possibility of boosting his confidence by showing his competence, as opposed to discouraging him by focusing on things he struggles to do. While he was in assisted living, I also played music during the evenings when he was suffering from insomnia and having visual hallucination. It was like what people would call sundowning. We also kept more lights on during this time and gave him some medication. I was trying to keep a balance between stimulating his brain and keeping him focused on the music and calming him down so he could sleep through the night. Music is processed in both hemispheres of the brain, which is why I think that the first language Dad was speaking in was Mandarin, in which meaning is heavily dependent upon the tone of the syllables. One music therapist had said that if the stroke survivor has damage in one hemisphere, music can actually help in a way to compensate for the damaged area. There's a type of therapy that was created in 1973 called melodic intonation therapy. Our speech therapist does not use this with my father, but it is where therapists try to create a quote-unquote melodic contour that follows prosody of speech and rhythmic tapping of the left hand that accompanies the production of each syllable. This means that they take useful phrases, starting with the most simple phrase like, I love you, and they attach melodies to them following their normal stress and intonation, while tapping out each syllable in order to engage language regions in both hemispheres of the brain. Another study in 2014 showed that listening to music stimulated structural changes in the brain responsible for verbal memory, language skills, and focused attention. Music therapy is a field that is still quite young compared to its counterparts, but because music is such a great motivator, has been shown to have a positive effect on mood and memory, isn't particularly invasive, and doesn't cost a lot of money, I think it would be beneficial to continue to conduct large-scale studies in this area. I can see how it's difficult to gather data with stroke studies. I think people just want to do whatever they can to regain their loss of function and not be limited by a controlled study. There might also be issues of getting consent from someone with impaired cognitive function, and many people are so busy just trying to get through another day that they cannot participate in studies. We need to be able to figure out what is possible, though, for current and future survivors of strokes.